Thus, the steroids that affect the electrolyte metabolism, we call them as mineral corticoids, and that affect the carbohydrate protein metabolism, they favor lipolysis, we call them as glucocorticoids. So let us talk about glucocorticoids first. Now, the therapeutic uses of adrenocorticoids in general are many. They are used in the replacement therapy in adrenal insufficiency, means your adrenal cortex is not working properly, so there is deficiency of these hormones. So glucocorticoids are used in the treatment of rheumatic conditions, inflammatory conditions, allergy, and many other disorders. Similarly, in acute bronchial asthma, eczema, that is skin problems, systemic lupus erythematosus, ulcerative colitis. Glucocorticoids may be palliative in acute leukemia and Hodgkin's disease. And finally, in all kinds of shock, they stimulate the heart. So first we talk about glucocorticoids. The first is cortisone acetate. This is 1721 dihydroxypregnenolone 4 in 3,11,20 trione 21 acetate. Cortisone is available as odorless crystalline powder insoluble in water, melting point 240. This is specifically used in combination with desoxycortisosterone acetate in adrenocortical insufficiency. And the dosage for replacement 20 to 70 milligram daily for anti-inflammatory effect. And topically, you will find in some of the preparations to the conjunctiva 1.5% ointment. So the dosage form tablets, and ophthalmic ointment 1.5% sterile suspension. Then we talk about hydrocortisone. Hydrocortisone is available as brand name is cortisol. If you see the structure, this is 11 beta, 11 17 21 trihydroxy, pregnine 4 in 320 dione. Now this is a white odorless crystalline powder, melting point 215. Now this is preferred drug for the replacement therapy in acute adrenocortical insufficiency and salt losing forms of congenital adrenal hyperplasia, effective in intestinal bowel disorders and ocular inflammatory disorders, dermatological disorders. The dosage oral for replacement 25 to 50 milligrams per day and 20 to 40 milligram in a divided 3 to 4 divided dosage. Topically to the skin, 0.125 to 2.5% cream. So we have the dosage form as cream, gel, ophthalmic solution, sterile suspension, ointments. We talk about prednisolone. This is 11 beta 1721 trihydroxy pregna 4 in 1,4-diene 320 dione. This is white odorless hygroscopic crystalline powder with a beta test, and this is a very slightly soluble in water, sparingly soluble in alcohol, and slightly soluble in chloroform, melting point 235. This is a drug of choice for all conditions in which routine corticosteroid therapy is indicated, such as inflammatory and allergic conditions. This is effective in asthma, rheumatic disease, and prolonged attack of migraine, also ocular inflammatory disorders, and in inflammatory bowel disorders. So prednisolone is used dosage for oral replacement therapy 5 to 10 milligrams daily, and available as tablets and creams. And lastly, we talk about betamethasone. This is 9-fluoro, 11 beta 1721 trihydroxy, 16 beta methyl pregnawandfodine 320-dione. This is available as white. Odorless crystalline powder, insoluble in water, slightly soluble in alcohol, and sparingly soluble in chloroform. Melting point 240. This is a potent glucocorticoid, 20 to 30 times more active than that of cortisol, used in the treatment of various skin disorders, for prophylaxis and symptoms of asthma. Very effective drug here, and inflammatory intestinal disorders and colitis. The dosage: oral adults 0.6 to 7.2 milligram daily in the single or divided dosage, and for children 17.5 milligram per kg of body weight, topically 0.2% cream. Dosage form: tablets, cream, syrup, and betamethasone valeriate, that is aerosol. Storage in light, airtight containers protected from light.